Hello, my name is Samir, and I will be describing how various components of the patient's health challenges interrelate. First of all, I will start with the admitting signs and symptoms of the patient. So, diarrhea is a watery stool bowel movement 3 or more times a day that may cause dehydration. And as indicated, the patient had 3 bowel movements on the day of assessment. The second medical condition is hypoxia. Hypoxia can be defined as inadequate cellular oxygenation that interferes with the cell's ability to transform energy. Hypoxia may be caused by a decrease in blood supply, which can interrelate to the patient's issue of having a transient stroke. Since the patient was diagnosed with pneumonia, we can interrelate hypoxia to ventilation, perfusion, or respiratory problem that reduces the amount of arterial oxygen availability. The patient is also diagnosed with chronic heart failure, which occurs due to a number of factors. When the heart is unable to pump enough blood to the body tissues, the body compensates by forcing the heart to work more. So we can see how the patient was admitted with hypoxia as well. The most common cardiovascular diseases are coronary artery disease, also known as ischemic heart disease, and it happens due to poor blood flow to the heart, which can result to reduced physical activity, and it can also reduce oxygen delivery as mentioned earlier. Heart failure, particularly right-sided heart failure, blood can back up into other tissues such as the liver and the abdomen, causing congestion in these areas. So as a result of that, we can have, as in our patient situation, ascites because of the backup flow. One thing that may raise a concern for having atrial fibrillation, an irregular rhythm of the heart, is clot formation, which may block blood to the brain, causing a stroke. A quick side note, although COPD was not diagnosed, patient wheezing sound may indicate a development of COPD. Next, we have bilateral hydronephrosis, and it is an obstruction within the ureter causing backflow of the urine. Most likely, the patient doesn't experience any kidney stone, which is the most common type of blockage, because he does not experience fever, vomiting, or pain when urinating. In insulin resistant, there will be high blood glucose levels. Since the patient is obese, this may have contributed to his diabetes. Potential complications include fluid overload, which explains why the patient is on 20 mg of Lasix. Lasix may also help with increased JVD.